Thank you for standing by and welcome to the COVID-19 media briefing. At this time, all participants are in a listen-only mode. After the speaker presentation, there will be a question and answer session. To ask a question during the session, you will need to press star 1 on your telephone. Please be advised that today's conference is being recorded. If you require any further assistance, please press star 0. I'd now like to hand the conference over to your speaker today, Teddy Dishon. Thank you. Please go ahead, sir.
Good afternoon. I would just ask that reporters please limit themselves to one question today. If you have a follow-up that's on topic, please ask it quickly. Otherwise, limit yourself to one question. We'll get to Q&A after you hear from Governor Tim Walz, Commissioner Jan Malcolm, Director Joe Kelly, Commissioner Steve Grove, and Deputy Commissioner Heather Mueller. With that, Governor Tim Walz.
Good afternoon, Minnesota, and thank you all for joining us again today. Unfortunately, we're starting out expressing our condolences to 5 more of our neighbors who have become fatalities of COVID-19. Commissioner Malcolm will get into to some more of the details. We know that COVID-19 has disrupted life like many of us have never experienced, but folks are doing all they can, and I'm grateful, Minnesota, to try and find those activities and try and do the things that connect us to one another in a way that's safe, but expresses that the human experience is vast, and many things that we like to do, we need to figure out how to keep doing them. Today is National Walking Day, hosted by the American Heart Association. The executive order that we put out allows you to get outside. I would just remind people, don't bunch up, give wide berth to one another, get out there, stretch your legs, do things. I know I have been on my treadmill in the home for 12 days, and I know how good it'll feel to get out there and do it, so do that safely. And I heard a fact today, maybe a trivia question, but it becomes very poignant in this time. It's April, and this will be the first April since 1883 that baseball has not been played, an April baseball. So I understand that people are making changes. We're doing the same, but all with the effort to provide us the opportunity to get on the front end of this, to keep our neighbors safe, and to beat COVID-19 in a way that lets us return as quickly as we can to those things we so enjoy. Just a few announcements on changes. Before COVID-19, I was scheduled to give my State of the State address. That has changed, but I'm happy to say we're going to reschedule that Minnesota State of the State to address Minnesotans this Sunday evening, April 5th at 7 p.m. It will be me and my residents with a remote camera, and that will be something unusual, but it is appropriate at this time as the character of Minnesota is shining so brightly that we address where we're at and, more importantly, where we're going, because the future is there. It's one that we get to choose what that's going to look like, and that's what all of these plans, preparations, and executions you hear about are for. The next postponement, again, is very disappointing, I'm sure, to so many of you, especially to me. We are going to be postponing the 2020 Minnesota Governor's Fishing Opener until May 6th through the 9th of 2021. We want to give a special thank you to everybody up in Otter Tail County, community leaders who have been planning this for well over a year. This is a time-honored Minnesota tradition. Those of you who out there listening have taken part in this. It is like nothing else I've ever done, and it's one of the most enjoyable weekends. And so we're going to postpone that, but it doesn't mean we're going to postpone fishing. The opener is still happening on May 9th. We encourage people to get out there, keep a safe distance, watch the DNR's website. We've got 11,842 lakes, and as I remind Wisconsin, as they try and measure every mud hole as a lake, we still have more. So there's opportunities to get out there, get some distance, enjoy the great outdoors. And I'd like to stress today, too, that it's Census Day today. While we're fighting COVID-19 and our focus is there, we need everyone to fill out those cards you got in the mail, get online, go by phone. Just takes a few minutes, get it sent back in. It's critically important for understanding how our communities work, a fair representation, state, federal, local levels. It helps plan everything from road funding to hospitals to senior centers to emergency services. And in a state like Minnesota that receives very little in federal dollars, I believe we rank 47th of the 50 states in federal dollars coming back to Minnesota. Each person undercounted is about $28,000 over the life of the census. So I encourage everyone to get out there. Before you hear from Commissioner Malcolm, I spent the morning talking to folks from the Minnesota Council of Foundations. I'm reminded again how blessed we are to have civil society and folks out there that are incredibly generous. We consistently rank as the most generous state, and incredible leaders in the foundations that are building a safety net that is second to none, especially now when we need it. So I want to thank them. And I was on a call with all the governors of the 50 states and the 5 territories, and exchanging best practices. I will say, though, one of the frustrations that came up is the testing issue. And I think the frustration came up for me is that I heard yesterday in the briefing that there's massive testing, that the states just don't know how to use it. And I am here to tell you, not a single governor agreed with that, and not a single governor is not fretting over trying to get this testing regimen up because of understanding how critical it's going to be as we come through this first wave. So with that, and we'll be back to answer some questions, of course, I'll turn this over to Commissioner Malcolm at Minnesota Department of Health.
Thank you, Governor. Good afternoon, everyone. Today's situation update, starting with kind of the global totals. Globally, as of this morning, we had more than 873,700 cases and 43,200 deaths. Those numbers change every hour, as we know. In the United States, 189,633 confirmed cases, over 76,000 of those in the state of New York, and almost 19,000 in neighboring New Jersey alone. U.S. this morning reporting just over 4,000 deaths, 4,081, 1,096 of those in New York City alone. In Minnesota, we have now a total of 689 laboratory confirmed cases in Minnesota. That's up 60 from yesterday's total. And as the governor mentioned, sadly, we confirmed 5 more COVID-19 related deaths, bringing us to a total now of 17 in the state. These were all among people over the age of 70, 2 of them associated with long-term care facilities. Chris Erzman is on the phone as a resource and can give more breakdown later if needed. The age range of our confirmed cases continues to be from 4 months to 104 years, with a median age of 47 years. Since the start of this outbreak, 122 COVID-19 patients have been hospitalized in Minnesota. As of today, there are 54 patients hospitalized, 27 of those in intensive care, 27 in regular medical surgical beds. That represents actually a decline in people having been discharged from the discharged from medical surgical beds, the decline of 3 and an increase of 1 in ICU patients versus yesterday. As of today, 342 patients have come through the disease period and have now been released from isolation. And as we keep repeating, this total of 689 laboratory confirmed cases we know reflects only that, the results of lab testing. There are more cases in Minnesota, and we absolutely urge everyone to assume that the virus is circulating in your communities. And if you look at the geographic map of Minnesota, you see how that is filling in with more and more counties having laboratory confirmed cases as well. Yesterday, there was a total of 1,400 lab tests run on individuals through a combination of the state public health lab and private labs, so average volume of testing yesterday. Public interest continues to be high, of course, with a lot of visits to our website and our public hotline. We won't repeat those numbers here unless you need them later. I would just like to make a couple of additional comments for today. As we mentioned yesterday, just would like to reinforce it again. With holidays coming up in the next week, at the same time that we're seeing a continuing increase in confirmed cases in Minnesota, we strongly urge all Minnesotans to keep up the effort to stay at home and to avoid gatherings with anyone outside of your household group. This includes having only telephonic or virtual visits with your loved ones in nursing homes or assisted living. Difficult as this is, it is essential to help us limit the spread of the outbreak in our communities, and it's a particularly essential tool to help protect our most vulnerable Minnesotans, those who are elderly and those with significant underlying health conditions. I'd like to also repeat something Director Kelly said yesterday. Many Minnesotans are asking how they can help, and donating blood is a particularly great way to do that right now. Blood supply is under a lot of stress with blood drives being canceled, but people can be assured that giving blood is safe. Organizations are offering appointments, and they're very careful to promote social distancing throughout the donation process, so please do consider that. I'd like to just make a couple more comments on the governor's point about laboratory testing and materials. All of us in Minnesota have been working very hard to maximize our ability to test and to focus particularly on those for whom testing is most important in their course of treatment and most important to contain the spread of the disease. As we have reported, we continue to monitor our supplies. It's not just about the test kits themselves, which were such a focus early on in the epidemic, the test kits from CDC. It's also about the supplies in the laboratory and chemicals like reagents that are required to run those tests. As of today, we have enough chemical reagents to run about 100 tests. We have multiple platforms for running tests, as we mentioned before, but supplies for our highest capacity testing platform are back ordered until May 1st. So that's just an example of the supply chain issues that the governor mentioned. We have had multiple phone calls with the U.S. Department of Health and Human Services at the highest levels based on the governor's personal request to Vice President Pence. We've sent specific supply requests and have not heard back. Congressman Emmer's office made the same request on our behalf and was told the supplies were on their way. However, follow-up from his office to Health and Human Services was not answered to the best of our knowledge. So none of the requested laboratory supplies that we have talked to HHS about have materialized in Minnesota at this point, to the governor's earlier point. Fortunately, though, Minnesota hospitals are really stepping up to the plate and developing their own testing platforms to supplement lab capacity and working directly with manufacturers for supply and trying to use different platforms that use different reagents. However, we're told by our healthcare providers that many of their supplies are also on back order. And of course, the lab supplies aren't the only point of concern for resources. Even if we had plenty of testing supplies in the laboratories, the healthcare provider system still needs swabs to take samples from patients, and those are in very short supply, as well as personal protective equipment for the providers taking the swabs, which is also in very short supply. And even if we had the PPE and the swabs for the facilities to take a sample, we need to have enough people to take the sample. So all of these really make the testing situation quite a bit more multi-layered and complex than what I think some of the messaging from our federal colleagues has been. There are new testing strategies being developed, which is a very good thing, but they're not yet available on the market for us to take advantage of, but we absolutely look forward to that, and that factors strongly into our going forward testing strategy for Minnesota, having rapid testing at the point of care delivery, so in the clinics themselves, as well as serologic or blood tests to help identify people who've had COVID and have successfully recovered and may now have some ongoing immunity. So those are all some additional points of context that I hope are helpful to understanding the reality of the lab testing challenges in Minnesota, but we are hopeful that that our future lab testing strategy will get filled out by these additional methods that are being developed now. With that, I will turn it over to Director Joe Kelly from the State Emergency Operations Center.
Well, thank you, Commissioner, and hello again, Minnesota. Well, I can tell you that the State Emergency Operations Center is a very busy place, and it's getting busier every day. The talent, energy, and commitment being applied to everything from answering the public's questions and concerns to finding more personal protective equipment to identifying potential temporary hospital sites is truly impressive. One of the most amazing things happening here is the amount of offers of help that we've received from around the state, from our largest corporations to individuals, families, community groups. Our public-private partnership inbox has received more than 800 offers from entire buildings to services to homemade face masks. It's really gratifying to see how much you all want to help Minnesota get through this. And speaking of homemade face masks and the challenges we're having with personal protective equipment, a lot of people have offered to put their sewing skills to good use by making reusable cloth masks. As we all know, the FDA-regulated masks are in short supply and will likely get scarcer as this incident unfolds. Our top priority for those masks and respirators, those that meet government standards for protection, is our frontline health professionals who care for patients in the hospitals, because we need to keep our doctors, nurses, aides, and facility staff healthy so they can take care of the rest of us. And that means preserving all the medical-grade PPE that we can for them. The rest of us need to be protected, but to a different degree. And as the commissioner and others have talked about, one of the insidious characteristics of this virus is people who haven't shown any symptoms could be walking around and spreading the disease without knowing it. A homemade cloth mask could help prevent that kind of spread by what the experts call source control. Cloth masks also provide some protection from getting exposed to the virus, and those are most appropriate in low-risk environments. Remember, the coronavirus is spread by droplet, not airborne particles, and cloth face masks are a good tool for source control, especially as we try to stretch our supply of those FDA standard masks. You can find guidance, patterns, and other useful information about making alternative face masks on the Minnesota Department of Health website. If you are so inclined, if you're kind enough to make cloth masks for donation, I suggest you distribute them locally. Give them to your community hospital for use by workers who don't have direct patient care responsibilities. I'm talking about dietary staff, janitorial workers, administrators. Alternative face masks are also appropriate for people working with or visiting the elderly, and we know they are among the most vulnerable. Get your masks to a jail or correctional facility where people are working and living in very close quarters, and social distancing is a challenge. That would help protect both corrections officers and the incarcerated. Give them to the transit drivers who provide critical transportation services in our cities and across the state. The best path for locally produced homemade cloth masks is for them to be distributed locally, and you can immediately protect people in your community, your friends, your neighbors, and your coworkers, and it will help keep everybody healthy and safe. It also feels like a very Minnesotan thing to do. So thanks to all of you who have made those offers. Next up is Commissioner Steve Grove of the Department of Employment and Economic Development. Commissioner.
Thank you, Director Kelly. Hello, everybody. Wanted to remind folks on the call and small businesses across the state that there are now several different levers available for small businesses who are facing challenges given the crisis, and we at the Department of Employment and Economic Development have published a guide for any small business in the state to navigate the resources available both on a state and federal level. So if you go to mn.gov/deed, up in the right-hand corner there, you'll see a guide for all small businesses, and it'll walk you through everything from the SBA programs available to the state emergency loan programs that are available, to the state loan guarantee program that has been stood up, and help each individual business understand which direction you should take given your situation and what you need. We are continuing to compile resources there and just want small businesses to be able to navigate this really usefully. In the past couple of days, we've added 6 more community lenders across the state to help administer the Small Business Emergency Loan Program so that more communities have access to lenders they know and trust to pull those loans from. And we've signed up our first 4 private lenders for our Small Business Loan Guarantee Program, which helps the state back loan applications from small businesses with private lenders so we can free up $20 or $30 more million in capital for small businesses there. Lots of questions, of course, coming in on the federal relief package that has come through the CARES Act. We continue to work with our colleagues at the Department of Labor and the Department of Treasury to move that funding to the state as quickly as possible. We are still awaiting some guidance from them on the ways in which that funding will be distributed and some of the guidelines around it, but just want Minnesotans to know that your state government is moving as fast as possible to free up that money, and we're thankful for the federal government moving quickly to pass some of these measures that really only the federal government can make possible and available to businesses and workers across the state. So we'll continue to update people on that because we're getting a lot of questions there given the passage of that bill. One of the things that is really important to us is we know that the communities facing the steepest challenges to this crisis need extra outreach, and we've been spending countless hours answering questions and doing outreach to communities across the state, and we want to ramp those efforts up even further. So starting tomorrow, we're going to be holding a series of regular calls for community leaders across the state and targeted communities, outlining our resources, answering questions. We want to make sure that members of disparately impacted communities are aware of these resources that we are creating for vulnerable workers and businesses across the state. Unemployment insurance claims continue to rise. We are, as of last night, up to 272,766 applications since the crisis began on March 16th, and we started opening up those benefits to more people. Yesterday, we had 17,411 applications, which is up slightly from last Tuesday's numbers, which were around 15,000, so we are seeing an increase there. You know that a lot of applications are starting to come in from healthcare occupations, and that's not surprising in a sense that we've had to pause operations of elective surgery staff and dental hygienists and dental assistants across the state to help stop the spread of COVID-19 during this time. We did want to highlight to healthcare professionals who are finding themselves temporarily sidelined from their day-to-day job that there are a lot of healthcare occupations that are hiring right now, and that's always the case, but it's especially the case now with nursing assistants and social service assistants and registered nurses and security guards and personal care aides, all in high demand at companies across the state. I was just talking to the team at Presbyterian Home and Services over in Roseville. It's a senior and assisted living center. Like so many others across the state, they are in dire need of employees. They've got 667 open positions there, and so many other facilities across the state are hiring. So if you're a healthcare worker that is temporarily sidelined or seeing hours reduced and you have the capacity to go pick up additional work, please look at those nursing jobs, personal care aid jobs, human service jobs that are so critical right now as we prepare for this crisis to unfold and for more cases to hit our state. Wanted to start to give a highlight or a view into sort of how Minnesota is faring compared to other states, just as it relates to the industry mix that we have here. We know that certain industries are being hit harder by this crisis than others. Leisure and hospitality comes to mind for sure, given the closure of those businesses, and every state's hit hard there. Minnesota has about 7.8% of our jobs in that field compared to 11.4% nationally, so we're a little on the lighter side of impact there, although certainly the impact is hard where it is hit. The states that face the most challenges there are, not surprisingly, Hawaii, Nevada, and Florida. On retail, of course, retail has changed significantly given most brick and mortars have to move to online, and social distancing changes the retail environment significantly. We've got about 9.8% of our employment in retail in the state. That's one of the lowest shares among states. So compared to other states, we're faring a little bit better there, as we are in the energy sector. Given the low prices of energy, we're actually benefiting from that in terms of gas prices here, but other states are hit hard there. One of the industries that is tougher for Minnesota is, of course, manufacturing. It's the highest percentage of GDP of any industry in our state, which we're very proud of. Many amazing manufacturers here in the state. About 11.4% of our jobs are in manufacturing compared to 9% over the nation. And so, we're working hard with those manufacturers to mitigate this crisis. We know that supply shortages and some of the disease spread on plant floors is something that manufacturers are all taking very seriously during this time, and state government wants to help. Lastly, I would just say we continue, as Joe says, and the governor continues to highlight, we're seeing lots of great examples of Minnesota businesses doing the right thing and just finding ways to help organically. One of the things that we know so many restaurants are trying to do right now is offer takeout and delivery, and making customers aware of that is so important so that they know that they can get that food from your establishment, that you're still open in a new way. And so we've seen really interesting stories of graphics companies, Horsch Graphics out in New Ulm, or Nelson Brothers Printing in Fergus Falls, offering free signage to local restaurants so they can alert customers to the fact that they're open. Companies helping each other out in towns across the state is just a great example of Minnesota businesses coming together and helping us all get through this challenging time. So with that, I want to turn over to our Department of Education, and we'll hear from our Deputy Commissioner over there, Heather Mueller. Heather.
Thank you, Commissioner Grove. Good afternoon, everyone. The update from the Minnesota Department of Education today is a short one, and that should be good news, and that's because our educators and our students and our families are in it. They are working through the distance learning plan. And we're continuing to get really good feedback from our school districts and charter schools about how distance learning is going. We have been monitoring the national stories about some of the popular online teaching platforms that are experiencing some glitches, but the educators and the school districts who are utilizing them are working through them as they would at any other time, whether they were in a school building, or they are working from their homes. They are adapting and adjusting just like they always do. And so we see this as an opportunity for them to continue to hone their skills and do what they do and that they've been trained to do. In case you missed it, we had this conversation yesterday that the U.S. Department of Education has approved a waiver to Minnesota for the federally mandated standardized statewide assessments, accountability, and reporting requirements. So that means that Minnesota schools will not be administering the 2019-2020 MCAs and MTAS tests for this year. And with that, I'd like to hand it back to the governor.
Thank you, commissioners. Let's go right to questions today.
Operator, we're ready for questions.
Okay, as a reminder, if you would like to ask a question, you'll need to press star 1 on your telephone. And to withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. All right, your first question comes from the line of Matt Sepik from Minnesota Public Radio. Your line is open.
Hi there. This is a question for Commissioner Malcolm. I am wondering, has anyone who has been in the intensive care unit recovered? Is there anybody out of ICU who's been hospitalized for COVID-19? And in the count that you've been releasing of people in the ICU, does that include people who no longer need to be isolated? And then as part of that, how long are people staying on ventilators who require a vent?
Thanks for those questions. I'll ask Chris Erzman to answer that if you can, Chris.
Sure. So the number of people in the ICU is changing constantly. So we have had 122 individuals who've been hospitalized over the course of time that we have been tracking for COVID-19, and we know, and we've also, had a number of people who've been in intensive care. So yes, people are getting out of intensive care. And in terms of the length of stay, we don't have that information, but we are beginning to do a more in-depth evaluation of all the hospitalized cases, so we will ultimately have that for you.
Okay, but no idea yet of how many people are out of the ICU.
I'd have to go back and look at the data more specifically, so we can look at that.
Okay, thanks.
Your next question comes from the line of Tim Nelson from Minnesota Public Radio. Your line is now open.
Hi, Governor. Thanks for taking this question. U.S. deaths have now surpassed China, and the Washington Post is reporting that the national stockpile of PPE is almost gone. Do you expect you're going to have to extend our stay-at-home order beyond April 10th, and when would you make that decision?
Yes. First of all, the PPE issue is, again, the governors were deeply concerned about that. I think the public is now seeing, without the lack of a real cohesive national strategy early, it disrupted the supply chains in a way that has made that hard. When we announced our executive orders, as we gathered data and looked at it, one of the things I said on that day was we would continue in real time to reevaluate as we get closer. I think seeing the administration, the Trump administration, change their tune on this, of seeing that it's much more pervasive than I think they were first letting on it to be. We knew that very well may happen. So what we'll try and do is give people as much lead time. I don't think I would be, I think I have to preview at this point in time. Our peak is still coming. We are seeing real evidence that social distancing is working and slowing this down. We'll evaluate as we get closer, but I would anticipate sometime towards the early to middle of next week, we'll be making that determination based on the data.
Thank you.
Your next question comes from the line of Emily Havoc from KIRE11. Your line is now open.
Hi, Governor. It's Emily with KIRE11. I have a question about Senator Gazelka is calling on you to implement the Emergency Management Assistance Compact, saying that it would allow nurses from other states or other places to come into Minnesota and help. Are you considering that, or do you have a response to that?
Well, we certainly consider everything in this the situation that we're in of looking what it takes. The one thing I would say is Minnesota has a deep supply of medical personnel and healthcare personnel. I'm not certain I'm seeing where people are searching and moving around other than when they're called in an emergency situation. So I think each and every state is going to be pressed to the limit on this, but I'm certainly open to listening where they're at. That's at this point in time, our hospital associations or any of them, no one has brought that up or mentioned that as a potential solution, but we're always willing to look at anything if it makes sense.
So I guess the follow-up would be, since he sent that out, my question when I saw that was, are we currently not allowing nurses to come in from other states and work in Minnesota? Is there something in the law that's not allowing that at this time?
Well, each of our states have
licensing.
Yeah, it's licensing requirements, and we've made some of the moves on those. We certainly want to make sure people coming in that they are qualified to do the work they're going to do. We're certainly open to looking at it. I think, this is something that's been brought up in times of non-crisis, whether we should just allow people to come in. It goes to many professions. So there's an ideological school of thought that goes in with moves like this. I'm not really interested at all in that right now. What I'm interested in is if there's a need for healthcare personnel, and this is something that would be needed, and if there are people clamoring to come here to provide that and we can do it safely, I'm certainly open to look at it. But as I said, again, that is not a request that has been made by anybody in the medical field at this point in time.
Thank you, Governor.
Your next question comes from the line of Tom Hauser from KSTP-TV. Your line is now open.
Thank you for taking my call, Governor. By far, the most email and Twitter messages I get are from the 250,000 newly unemployed Minnesotans. And I have a question for both you and for Commissioner Grove. I know he addressed it a little bit about how that national stimulus money, I think up to $600 per week, will eventually flow to Minnesota. I'm wondering if Commissioner Grove has a better idea of when that is going to happen. And then also for both of you, there are a number of small businesses that file as S-corps or sole proprietors, and they are not covered by unemployment, yet they employ a large number of people. A lot of them are afraid to take the loans that are available because they don't think they'll be able to pay them back. What kind of help is available to them? And I'll listen to your answers from both of you.
Yeah, Steve, I'll let you take up this first, then I'll fill on the back side because this is what, on the governor's call this morning, there was a lot of discussion on this as it deals with the federal's CARES Act.
Yeah, thank you, Governor, and thanks for the question, Tom. So we are happy to see the additional unemployment insurance benefits that came from the CARES Act. It is that extra $600 a week for families, or for workers rather. It's an additional 13 weeks if you've run out of your benefits already. And then it does open up the unemployment insurance system to independent contractors and the self-employed who aren't usually covered by unemployment insurance. So it actually expands the pool of people we can serve with the program. We are still awaiting guidance from the federal government on timing there. We're getting the same questions you are, Tom, from people who want to know how fast they can get this money. We're being told a matter of days and the $600. In terms of the extending the benefits to to broader cross-section of workers who aren't covered by UI, we're being told a matter of weeks there. The key thing we have to calculate there is that if you haven't been covered by unemployment insurance in the past, we haven't been tracking your wages, so we can't track the benefit that you'd be eligible for in the same way that we could if you were in the system. So the federal government's figuring out how they're going to suggest that states do that, and we're moving very quickly and in daily calls with the Department of Labor to navigate that. And, I think for any business that is facing challenges, which is, frankly, most businesses right now, looking at those loan programs is one helpful way. The funding that's going to be coming in from the CARES Act will help some of them as well. And, I think unemployment insurance in the meantime should stem some of the gap there. But I'll let the governor follow up more on that piece as well.
Commissioner, if I could do a quick follow-up with you before the governor chimes in. I got an email from a woman whose husband is nearing the end of his current 26 weeks of unemployment. There's probably a lot of people in that boat. Can that be extended?
Yeah, that's exactly what that 13 weeks piece is, Tom. So if that woman's husband is coming to the end of his benefits, but suddenly we find ourselves in a situation, as we do now, where the COVID crisis is extending people's ability to get into their work, that's what that 13 weeks is for. It's exactly for that kind of a person who's exhausted their benefits and needs more.
And, Governor, if you could chime in on just how important this is to you.
It's huge. And I want to be very clear, Tom, that, I know people out there, they don't want to hear be patient. They don't want to hear that while many other state systems collapsed, ours is still running. That is not what they need to hear. They need to hear results. I hear them loud and clear. Governors are talking on this very issue on how to implement this. We were talking, and they're trying to get Secretary Mnuchin on from Treasury. But what I can tell you is, Tom, is that I've asked our team, and I think all of you on this call and all your listeners, you'll see a little different format tomorrow where we are now stepped up, where our work groups and our lanes of responsibility are now coming into focus. The folks that are on this call with me have immense responsibilities in their area, but they are kind of the tip of the iceberg. There are thousands underneath working on all of these different issues, and I want them to be able to tomorrow be able to give you an example of what an individual is going to get. What does their benefit look like? What happens? You've got folks that I see this and they use social media. They mail me here, which they should do, and say, I just moved here a long time ago. I don't have a history, or a short time ago. I don't have a history of wages. I'm not in the system. What do I do? There's going to be many of these one-off situations. We view those one-off situations as an individual in crisis that we need to try and figure out. So I think the questions that you have and the frustrations that people feel around this and the work that's being done, while monumental, if there's somebody waiting for a paycheck today and it's April 1st, that is stress that is just beyond belief. And so what I can tell you is every day we're getting a little more on this. I hope tomorrow that this new brief with our work groups and some of our private sector partners and a little more very detailed about an individual, what they can do, and maybe try for us to do, in our frequently asked questions section on each of our websites, be able to walk people through this, because Commissioner Grove has said this all along. Many of these people, the vast majority, have never applied for unemployment insurance before, just in normal times, and especially now. So we hear you. I think the message, and I would agree, Tom, it's the number one message that I get too. And so we're being as empathetic, and again, it's only going to matter what the results they get, and what we're getting good results for a lot of people. We've still got people that we can't let fall through the cracks, so we'll continue.
And that's especially true for people with rent and mortgage due today. Are you concerned about them?
Absolutely. It's why we put the moratorium in place, and I hear from the folks who own the buildings. They've got bills due to the banks. The banks have, to stay within the regulations of making sure they're solvent. It's a reason that I reach out. I talk to all of those folks, and I know people are hearing this, and I hear you loud and clear. They say, well, a moratorium only pushes this back for a little bit further. Our goal, or our hope is that between the stimulus check that's going to come to individuals, the unemployment insurance and the strengthening of that out, the $600 addition that was put on top of that, I'm trying to get a feel on median wages if we can at least keep people afloat so they're able to do that. But yes, I am deeply concerned about that. If people, again, I would remind them to call us or the Attorney General's office if there's any problems on evictions. Those have been put on hold, but I do hear them about, but rent is still going to be due at some time. Mortgage payments are still going to be due. Bank notes on apartment buildings are still going to be due. And those are things that I think we're already talking stimulus for with our federal partners and as governors.
Thank you, Governor and Commissioner Grove.
Your next question comes from the line of John Croman from KARE. Your line is now open.
Hello, Governor and COVID team. My question is, now that there may be more demand for masks, whether or not you're going to take a second look at granting workers' comp benefits to first responders and make it a presumed workplace disease. And the second follow-up to that is anything being done to beef up the phone capacity of DEED for people who are worried about unemployment? Thanks.
Steve, I'll answer the first one on the first responders. The simple answer to that is that should have been done. There was a disagreement amongst some in the legislature who were making the assumption they were already covered. We don't believe they are. I am trying to do my best to work with the co-equal branch, but I am prepared to take executive action on this if they're not able to find a solution together as quickly as possible. With that, Steve, I would turn it to you on the phone lines.
Yeah, thanks, Governor. It's a great question. We have expanded our phone lines by about 75 people thus far. We've just redeployed people from other parts of our agency into those phone lines. In fact, I was just up on the 5th floor about an hour ago, and we have a whole new wing of the agency where there's new cubes, new phones, people are cranking. We've got call times down to about 25 minutes a call. They were up over an hour last week, so we are making progress. But I think it always bears reminding people that you're just not going to have a great experience when you call in, given those wait times. And every single question that comes through those call lines can be answered online. We really want to keep those call lines open for folks who don't speak English and need language support or essentially password issues. And you should know that the team tracks every single application with great care. There's a huge culture of customer service in the Unemployment Insurance Division. But of course, they have gotten more applications. We've got more applications in the last 2.5 weeks than we got in all of last year. So we will proactively reach out to people too. You may get a call from us if you have an issue with your account that we need to fix. We know it's a challenging time, and to the Governor's point a moment ago, so many people are new to this program. We want to make this as easy on them as possible. So we're going to keep growing that capacity, but pushing people to that online platform at uimn.org.
Thank you both very much.
Grove. Yeah, thank you, John. Commissioner Grove, could you speak to, are there a number of people that have checks in hands by now, or when can folks start to expect that after their app has been processed? I know that puts you a bit on the spot, but I want to be very cognizant and very empathetic to folks out there who they're showing great patience, but if you're frustrated, worried, and nervous, we understand that. So if you've got any idea or you can share with us, I'd appreciate it, Steve.
Yeah, Governor, it's a great question. Of course, that's everyone's question, right? How quickly can I get paid? And we are moving extremely fast there compared to what we usually can. We have engaged our payment processor at U.S. Bank, who's added a ton of staff to that processing as well. Bottom line is this: it's going to be a week or two after you apply. That's about the window of time that we can get you the money that you need. It's faster than it has been before, and the increased staffing has helped. But from the moment you apply, it takes about a week or two. And we will backdate from the day that you were separated from your work. So I know that with this new system, people applying on different days based on your Social Security number, some people are wondering, well, does that mean that if I am unlucky and my last number of my Social Security number is a 7, and so I got to apply on Wednesday instead of Monday, that I'm 2 days behind? No, we will backdate your pay to the day you're separated from work. So I want to assure people that you will get the money you deserve and as quickly as you can possibly get it out.
Thanks, Commissioner.
Again, if you would like to ask a question, press star then the number 1 on your telephone keypad. Your next question comes from the line of Jeff Wagner from WCCO. Your line is now open.
Thank you all for taking my call. Director Kelly, you mentioned earlier when you were talking about the reusable cloth masks, the homemade face masks, talking about how people who haven't shown symptoms might be spreading it, but that a homemade cloth might help. Are you saying that the average person who doesn't even interact with, the elderly should just consider wearing one in case they're asymptomatic? For so long, we've talked about the masks not helping with preventing you from catching the virus. It's only a matter of preventing from spreading it. Have we reached a point where it's being advised for the average person to wear it just to prevent their own potential of spreading it if they're asymptomatic and they're at the grocery store or going for a walk?
Thanks for the question, Jeff. I am absolutely going to defer to my friends from the Department of Health because that's a mitigation for community spread issue. So maybe Chris Erzman or the Commissioner Malcolm can answer that.
This is Commissioner Malcolm. I'll jump in first and certainly invite Chris to comment as well. That discussion's really picking up in the last day at the federal level. We've heard federal leaders, Dr. Fauci and others, beginning to advise that that's not a bad idea when out in public. So going to a grocery store, being around lots of other people, social distancing, of course, would not be overprotective at this point. Chris?
Yes, I think what the commissioner said is right, and what we're focusing on right now for source control, and by source control, we mean the cloth mask that can help catch droplets from you, the wearer, to protect other people. And so while this is a tool that may be useful for everyone down the road, our priority right now is making sure that we can make this type of reusable mask available in the healthcare settings. And we're starting with congregate care settings. And so we have been working with Director Kelly's team in the SEOC to make sure that masks can be made available for congregate care setting workers. And so, yes, I think it's something that we'll have more conversations on down the road, but as valuable as it is, our efforts right now are prioritized first to congregate care settings and then to others in the healthcare setting.
Thank you.
Your next question comes from the line of Dave Orick from Pioneer Press. Your line is now open.
Thank you. This is a question for, I think, the health side of things. The modeling shows that we're going to have a ICU peak demand of about 5,000. Where are we in terms of our ICU capacity? Where are we headed?
Commissioner Malcolm, and I'll just remind you that the model has not been rerun yet since about 10 days ago, so cannot give you an update on the projected peak time. That will be coming, as the governor said, next week. But was your question, where are we on ICU capacity right now?
Yeah, in terms of, it's not about the peak time. I mean, that could change, of course, but the model projected that doesn't matter when we peak, but in the near term, the peak is going to be 5,000 ICU, no matter how far out we push the peak. And so, yeah, what's our trajectory on ICU as we head toward that number?
Well, I think that as we've talked before, and I think we would propose to give you a kind of a deeper briefing from the folks who are closest to that work in coming days. But there's a lot of work going on to essentially repurpose some existing hospital capacity into ICU capacity. But the limiting factor really is the ventilators. So, and there are some things being explored, treatment pathways that might prevent some of that ventilator need, but we're really focusing on ramping up the available ventilators to go with the enhanced ICU capacity, and we'll get you some better, deeper expertise to speak to those questions in the coming days on the briefings.
Okay, I'm just any sense of the numbers? I mean, to be blunt, I'm not seeing that we're really on a path to get to anywhere close to 5,000, and so I don't know what kind of numbers you have that maybe suggest otherwise.
Well, I think we're going to have to revisit some of the assumptions in the model and just verify and clarify what the model projection was. We're refining some of those estimates as we go. So I think you're right. We've not spoken in terms of how exactly we will get to the 5,000 number. Different clinical experts are projecting a slightly different number, a lower need number for ICU capacity. So we're trying to reconcile those things right now.
Okay, thank you.
Your next question comes from the line of Bill Werner from MN News Network. Your line is now open.
Yeah, thank you. Thank you, Governor, for taking the question. I don't think I'm telling you anything you don't know that despite your stay-at-home order, that some folks are interpreting that pretty liberally. There have been exhortations for people to spread out more distancing and so on. Do you have other options in the toolbox, as it were, to enforce this more strictly? What are they, and are you considering them at all, and what kind of timeline?
Yeah, and this is certainly one of our bigger concerns because what we do know, and as I said, it's early in this bill, and I think always relying on data that's so early and not properly peer reviewed. But what we do know is social distancing works. And what we do know that Minnesota has done a pretty good job, but I'm going to be the first to tell you we need to continue to do better. I think people telling one another is certainly helpful. We put these orders in place. They do come with some force behind them, but it was not our intention to have our first responders out there, breaking up basketball games or telling people to walk further apart. But we need to continue to get the word out. We're going to do more with a media campaign around this. We're going to get some folks out there who are pretty well known telling you not to do it. I think this has been hard because, to be very honest, there were quite a few people who were just thinking this was the flu and that was it, and it wouldn't be that big a deal. It is that big a deal. So I can tell you I'm asking and imploring people, the more we do this, the more lives we save. The more we do this, the better chance we have to get out of this sooner, I believe, because we will start to catch up with some of the testing and the isolation of the people who most need it. But I will continue to implore the better angels of people. This is not about you feel good and you want to get out and do this. This is you may be asymptomatic carrier and add to someone else's misery or someone else's family. And I think just assume that the people around you are carrying it. Just assume while you're out walking on the lake and you feel good, if you get too close to that person who's out there, they have it. And think of the implications of that. So we'll continue to do the best we can. We're not in any way interested in arresting people, throwing people in. That was never the idea behind this. But like so many things, most people follow laws whether written or not. But when you need to have a little bit more, it's there to ask folks to get this right. And our police have enough to do. Our first responders have enough to do. I'm just once again asking the vast majority, and again, I'm not speaking to most of the folks out there listening, you're doing it, but it's just really helpful. And if you're one of those folks that you've been a little bit too close, just separate a little bit. Let's just do this and do it the right way. It is going to make a difference in the peak.
Governor, do you have a stepped up enforcement scenario laid out if you were to have to go there?
No, not at this point. I mean, the anticipation is that if you can't get a social buy-in, we have the ability of, certainly it's in law, but folks can be fined. But as far as trying to transfer folks from the job of keeping us safe in other ways, to simply tell people to, break apart because we know this makes a difference. There is not a concerted plan to sweep neighborhoods or whatever. It's just much more on, I think, an education campaign for us.
Thank you, Governor.
Your next question comes from the line of Jeremy Olson from Star Tribune. Your line is now open.
Yes, question for Commissioner Malcolm. If the state were to run out of the ability to conduct testing for COVID-19, do you have commitments from Mayo or other private providers to continue the testing of your high risk, your hospitalized, and your long-term care patients? Is there any guarantees that can continue if you run out?
That's been great partnership, and we're talking literally daily with all of the labs in the state to just assure that we are protecting enough capacity for the highest priority patients. We don't foresee running out At the MDH lab, we also work pretty hard to retain a kind of a critical capacity each day. What I was mentioning before is that, just as an example, is that the particular reagent for the highest capacity machine is back ordered for a while, but we do have capacity to continue to work with the less rapid throughput platforms.
Thank you. And I hate to break protocol, but it'd be, continue, please.
I was just going to say, Jeremy, that this is, again, the issue that all governors are coming up with. I think it's really important to understand that if that whole kit is not complete again and the reagents, this is a global supply chain. It's being pulled from everywhere. And even these labs that aren't state-run labs, they're running up against this too. So it's finding a new test that's maybe not as dependent on these reagents. It's finding a new test that the swabs and everything else are in good supply. But governors are really, really focusing on this, and it is challenging.
And I hate to break protocol and delay any others from getting questions, but a quick rundown of today's fatalities, where they're from, their age ranges, if you have that immediately available, would be helpful.
Chris, can you go ahead with that?
Sure. 76-year-old from Winona County, 92-year-old from Hennepin County, 81-year-old from Martin County, 81-year-old from Dakota County. And two of the cases, Winona and Hennepin, were associated with congregate care settings.
Thank you.
Operator, we have time for one more question today.
Okay. Your next question comes from the line of Steve Karnowski from Associated Press. Your line is now open.
Yeah, hi. Thanks for squeezing me in. I think this is probably for Commissioner Malcolm. I know that the Corrections Department is reporting 3 more cases at Moose Lake today, 2 inmates and a staffer. Do you have any more information on that? And have we had any reports yet to date of cases at any of our county jails?
I'm going to ask Chris to speak to that one as well.
Yes, we have been working with the Department of Corrections. We have a team that's focused on jails and corrections, and so have been in contact with leadership at the Department of Corrections long before they identified cases. And so we are working with them closely on the situation at Moose Lake. We have been working on making sure that appropriate individuals are isolated, others are quarantined, and so we feel that we have a good plan with them. We have not identified any cases in jail settings at this point, but again, we have a team that is focused on those areas and available for support.
Great. Thank you all for that. Again, as I said, I preview a little bit tomorrow. We'll have a little different format with a few different presenters as we've kind of made sure that those lines of responsibility are getting more locked in with our private sector partners. I want to just say after I get off this call, I'll be on with the Rural Hospital Association and the nurses, folks who are on the front lines of this. I remind folks, I know you don't need it, but those healthcare providers are in a really tough situation. Anything we can do to make their lives a little easier, and I know neighbors are doing this to one another. I'm hearing great stories. That's why I'm telling a lot of these, whether it's taking bars over and setting them on the porch or making sure that folks are taking care of the things that those health providers come home at the end of a long shift. I do want to say, though, again, that Minnesota are just providing numerous opportunities for great stories. And the one today, a company called Woodchuck USA, they founded by 2 University of Minnesota alumni. They produce sustainably sourced, handcrafted wood products, have shifted their entire operation over to building face masks for the medical industry. They're now shipped out already 1.6 million face shields that hold up to the highest standards that are needed. Those are the quality type things that need to be there. When asked, Ben, one of the founders, when he asked why you see this, he said, we're not in this to compete with anybody else. It's, let's compete with the virus. Great Minnesota spirit, putting themselves and their manufacturing in to find this fight, and that's exactly what we need to do. We're in it together, Minnesota. we'll win this thing together, and we'll take care of our neighbors together. So look forward to speaking with you tomorrow. Goodbye.
And ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.